What's up, guys? Welcome to the podcast where we can listen to trans and gender non binary voices telling us their story in their voice, reminding us that each of us is not alone. Hey, everyone, welcome to another episode of Not Alone. I'm here with the one, the only Dr. Z, and I'm really excited to have her on because I actually was introduced to her via LinkedIn and I saw her all over. Then I went to her YouTube channel and I was like, this is incredible. So those of you who are gender diverse, those of you who are trans, those of you who are trans allies, you might find this conversation interesting because I've been looking forward to it for weeks at this point. But before I go on, I want to talk a little bit about, well, I'm going to let her introduce herself. But before I do that, I do want to point out she has a book that is out right now. And she is, well, that's the book. And she's going to tell us a little bit about that as well. So off to you, Dr. Z.
Hi. Well, first of all, it's such a pleasure to be here. Thank you so much for having me. Anytime I get a chance to talk about gender issues, transgender rights, I'm all up for it. So this is really, really phenomenal. Should I go ahead and introduce myself? Would you like me to do that? Yeah, let's do that. I'm Dr. Z. I'm not going to pronounce my incredibly tongue-twisting, difficult name. I go by Dr. Z. Everybody knows me as Dr. Z. And I'm a clinical psychologist that exclusively focuses on working with transgender and non-binary adults. That's all I do. That's the only population that I work with. I'm a content creator, as you already mentioned. I have a YouTube channel, and the mission of my YouTube channel specifically is to be able to provide top-notch, specialized content for people who A, can't afford gender specialists, or B, live in a part of a world where there is no such thing as a gender specialist. So that way they can take that information, process it, and even take it to, say, general mental health provider to help them figure out what's going on with them. So that's who I am. That's what I do. I love doing this. I love working with transgender community. It's very close and very dear to my heart.
But let me ask you this, Dr. Z. Where did you even get the idea? The psychologist. I know that it's an area that is being developed in the psychology world. I mean, it's one of those topics that it started off in the DSM-4. I think it was the version. There was a version in DSM-3 as well, and it's been evolving. And homosexuality was another area that I think it finally got pulled out, if I remember correctly, out of the DSM-4.
Yes.
The 5, I think. So talk to me a little bit about the history as mental health providers see for the trans community and how it's viewed by the medical and the therapy, the medical community.
Well, the mental health community right now, at least the colleagues in my field, clearly we all have the same consensus that gender dysphoria is not a mental illness. Gender dysphoria is actually a psychological distress that anybody feels when they have any sort of incongruency with their gender assigned at birth. And that's very different than having any kind of psychological, say, set of diagnoses. Gender identity clearly and obviously is a natural phenomenon, a natural experience that we all go through. Obviously, it's not a mental illness also. For me personally, what happened is I was always interested and fascinated by just individuals and their relationship to their gender. And that's how I got into the field. When I got my doctorate degree, for me, it was very important to focus on only one area and being incredibly good in that one area. I have a little bit of a pet peeve with my colleagues in the field. I generally think that psychologists should be probably specialized in at least 2 to 3 areas because I just don't know how you can help when you deal with every single issue out there under the sun. So for me personally, it was important to just nail it down, and gender issues, it was it. And then I just got deeper and deeper into the work and been there ever since, and I love it.
But let's start from the beginning, right? Because you mentioned this. You talked about this idea that it was initially an interest for you. You identify as a cisgender woman. You informed me. So if you identify as a cisgender woman, why did this pop out to you? Like, was it what was that eureka moment for you?
The eureka moment for me was my very first client after I got my master's degree when I was doing clinical internship. And this individual was a trans woman. And I remember listening to her story, and I remember listening to her narrative and her struggles. And I come from a depth-oriented psychology. So for me as a depth psychologist, it was so fascinating how one forms all of these relationships, specifically with their gender identity. That was a eureka moment for me. I think the eureka moment solidified when a lot of my colleagues at the time who were in the field were also cis, were telling me, don't you think it's strange that people want to change their gender? And I noticed myself feeling a sense of, no, if one wants to move to Italy, learn Italian, and claim to be Italian, why should that be any different? This is a personal sense of who they are. I don't think it's any different than any other aspects of our identities. So for me, just naturally, it just seemed kind of no-brainer. And I think that led into the work because I went into the work without any cis preconceived concepts of gender should be one particular way. I went into it immediately with an open mind, and that helped me tremendously.
So you talk about this idea that you went in there with an open mind. I have to ask, when did you graduate? Plus or minus, approximately. I don't need the specific dates. Right?
Doctorate degree, 2013.
Okay. So I guess what I'm really asking is, was the language around the trans community, around gender queerness developed? Because I find even now, the language is still evolving. So going back 10 years, what was that like when you were learning it, and how is it now?
Wildly different. I'm so glad how much the language vernacular has evolved over time, how much more we know about the formation of gender identity, how much we know about gender dysphoria and different ways that it can manifest and present itself. Back then, just to give you an idea, so my dissertation in my grad school was actually specifically working at understanding, oh God, the topic was, it's going to sound very complex, but it's really not. It's interpretive phenomenological analysis of preoperative trans women's perception towards their genitalia using projective drawings. And at the time, I had to do literature review, obviously on the subject matters that I was studying. Literature review was so incredibly tiny. Not only was it so small, but it was all aimed at trying to understand whether trans individuals had secondary type of severe pathologies, mood disorder, personality disorders, that compressed the bulk of the literature. So 10 years ago, or I would say probably even more than 10 years ago, when I was doing literature review, just to give you an idea, the way people approached gender diverse community was through the lens of there's got to be something wrong with you to desire to be gender other than the one you were assigned at birth. Versus today, obviously, it's wildly different. We have far more research. We have research on gender affirming care. We have research on gender affirming medicine. We have all of that research documents how beneficial it is.
So, sorry, I want to start from the beginning because I find that area, the evolution of it, so fascinating. And you are one of the few people who's actually done the actual scientific research associated with it. So we were in the past, we're talking about the pre-2013s. I mean, practically decades at this point, and the Stone Ages, if you will, in this community. But when you were looking at the conversations there and you were looking at pathologies, did you find any concomitant, I'm sorry, I want to avoid using medical terms, and any other disease states that do tend to go along with being gender dysphoric?
So you're asking me whether there were any kind of information out there that said that there's particular other diagnoses parallel to also gender dysphoria?
Yeah.
Sure, but because the literature review was, so let me backtrack.
Okay.
You have to know how to read research, right? That's one of the things we're taught at grad school, is to be able to read research and approach it from a very objective, fact-oriented point of view. What was the demographic studied? What was the cohort studied? How big was the sample? Was there a control group? All of the things go into the equation, right? So for me, while there was research that actually said, yeah, there's secondary diagnosis that parallel having gender dysphoria, I looked at it through a very scrutinized lens because I could also see the way that it was approached already with I would say biased point of view to begin with.
Preconceived notions. Yeah.
Yes.
So we go ahead. So I guess I'm trying to understand. There was research that said that there are potential pathologies that go along with it. It's one viewpoint. The question then becomes, we then, first of all, are you free? Obviously, more research came out after, but what kind of pathologies at that point were associated? Not necessarily correlation and causation, but well, correlation maybe, but not causation. But what did you see?
Right. So a lot of literature review back then aimed specifically at mood disorders, such as, for example, bipolar disorder and personality disorders. Um, so that was literature, but I want to make it very clear. Here's the thing: a lot of people misinterpret a lot of that literature review, and we need to understand that statistically, the amount of individuals who are gender diverse who also may be struggling with secondary diagnosis is just as much as the general population. So that's that's super important to note too. And then there's a lot of individuals who don't struggle with any secondary diagnosis. But for any of us to have any kind of secondary diagnosis is actually more common than we realize, even if it's kind of a more simpler, such as anxiety and depression type of diagnosis. So I want to be careful not to make it sound like we're pinpointing here that individuals with gender diverse experience also have other issues going on, and that's what causes, because there's absolutely no causality whatsoever out there. Sure, there may be individuals who may experience gender dysphoria and confuse that with something that may stem from gender identity, or core identity. For example, body dysmorphia is one of those things where a lot of times it's very common for that to overlap with gender dysphoria. How can it not, right? If you struggle with incongruency with your body, of course, you're going to also have body dysmorphia towards your body parts. So there's a lot of overlap. So just want to be careful to mention that out, because I hear that thrown out a lot of times that, people are trans because they're struggling with secondary diagnosis. And it's like, well, no, a lot of them don't struggle with any secondary diagnosis. And those who do, it's actually statistically most likely less than general population.
Oh, interesting. So what I hear you saying is that there was this initial research that said this. However, it was sort of like taking a specific population, putting them under the microscope, and going, "See, I'm seeing all these things." Well, you didn't look at it in the larger scheme of things,
Exactly.
And you didn't do actual comparative analyses. So it looked like there was a correlation, but that correlation may be representative of the larger population in general, anyways. Is that fair?
Yes,
Okay.
It's very fair. The research was very pathologizing, and the researchers, it's almost as if they went there with that preconceived pathologizing lens to look at it, to find something, to pinpoint, see, this is why you may want to go through gender affirming care, because you have this going on. And it's a wildly inaccurate view, incredibly inaccurate view to look at gender diversity in that way.
So now you kind of, we're pretending that you became an expert after your PhD. The truth is, you to get your PhD, you have to already become an expert in the space. But we're going to pretend like somehow the day you got your PhD,
nobody can be an expert. Nobody can ever be an expert. I always say this: compared to my peers in the psychological field who work with gender diverse population, I'm probably among the top % of people who know by far more about gender issues and gender dysphoria than anybody else, because I solely work with this population. So I would say it that way.
Okay, fair enough. I guess what I was trying to point out, though, is that once you got past your PhD, you started working more and more with patients. And I've done a few different interviews with various trans individuals across all kinds of life experiences. And I can already, I'm talking to maybe 10 different individuals deeply, but 10 different individuals, maybe more. You're seeing parallels of the same topics come up. Things like the first time you noticed this was probably before the age of 7 or 8. Not to say that that's always 100% true, but you see that often. You usually deal with family who is not open to this. Again, they're not necessarily evil. They're not necessarily mean bad for you. That's not a space that they're necessarily open to. You try to hide it and you try to fight it throughout your teenage years because you don't necessarily want to be different. And then at some point in your mid-adulthood so far, and again, it may be the population I'm talking to, but around your mid-adulthood, you kind of go, I can't do this. And I need to talk to people and I need to come out and I need to be who I am. But those are sort of just based on the 10 people I've spoken to. Tell me about what are some of these commonalities in the stories you're seeing where you go, yeah, I've heard this before.
That's interesting because I'm starting to see differences in commonalities, and that's great. That just lends us into deeper understanding of gender dysphoria and how it tends to be experienced across individuals. Generally speaking, and I work solely with adults. A lot of adults I work with, they have known since a younger age, and what happened is they tried to explore, just like children often do, in a benevolent way, try to explore and express who they are to their parents or caregivers or loved ones. And for a lot of them, their parents usually, and this could be because of parents' personal beliefs. It could be because of the environment they grew on. It just takes one look from a parent. Well, I always say this one look of disgust, of disapproval, of this is a big no-no, for a child to then take that experience and to completely repress it deep down inside, and for never to have that experience surface up until later in life. So in a lot of older adults, this is very common. Early onset of gender dysphoria, struggles throughout the life, feeling tremendous amount of shame and guilt associated with it. And then later in life, I have to do something about it. This is just excruciatingly painful to live this way. I'm also seeing a lot of times another story parallel that I see is for individuals to have no awareness of gender dysphoria in childhood and then suddenly become aware in adulthood. That's incredibly common too. And I always say that having childhood memories is not mandatory. It's not a necessity. It's not a precursor. Many people realize their identities later in life. Why? Because gender identity is complex. It's not easy. And because we live in a world where the world is also spinning its own narrative about gender, that narrative is going to be interjected. And then that's going to affect how you see yourself. Remember, gender identity is your subjective sense in relationship to gender. To understand your subjective sense, you have to experience it first internally and then externally. So it's subject to subject and subject to object, right? So there's a lot of it goes.
Okay, we're gonna have, hold on. I have two doctors, and I can tell you, you've lost me already. So let's do that. Let's go back maybe 30 seconds and do this for me again.
So gender identity is internal sense of self, right? It's how you feel yourself internally in relationship to gender.
Yeah.
It's first and foremost internal. Then it's also external, because it's also how that experience is now situated into the experiential field you inhabit, which is your environment, how people respond to you, how the world responds to you, through which lens everybody else sees it. So there's dualities that are happening. So the new internal sense is that you, for example, are of particular gender, but yet the world doesn't match up that sense of self. There's going to be a conflict, right? Mm-hmm. There's going to be a tension between the two. So for that reason, it becomes very difficult to sort out who you are. And that's why a lot of people realize later in life. The third group that I see, and this is the final group, are individuals who are starting to experience gender dysphoria onset solely during puberty, which makes complete sense, right? That's when we're having our secondary sex characteristics come up. And that's when people suddenly have this realization, oh, okay, so now I'm having all these markers, all the signifiers about my body that communicates to me and especially to the world particular gender conception, and now I'm not comfortable with it. So those would be the three most common stories.
So interesting. I'll be honest, I have met one individual, maybe two individuals who were later onset. I have not met anyone who was primarily during puberty. Very interesting perspective. Very interesting. I mean, it speaks to your knowledge base. It speaks to the vast variety of experiences you're having. I want to ask you another question. Are you seeing, and again, I don't want this to be a leading question. I'm trying not to make it a leading question, but are you seeing that? Okay, let me add more context. This is based on just talking to the 10 people I've spoken to. It does not necessarily represent everyone, but the individuals I spoke to are all high achieving. They have PhDs. I think vast majority of PhDs, vast majority are incredibly high achieving. Is that a commonality, or is that just the population I'm talking to?
That they turn out to be trans-identified?
Yeah.
I would say it's not so much commonality. I'm laughing because it's very familiar to me. So this is what happens with a lot of adults. Our sense of self, how we see ourselves. Imagine it, I always say, like a pizza pie. It's a whole holistic circle. Each slice represents a different aspects of who we are. Gender is just one slice on the pizza pie, right? So there's also your role as a parent, for example, and one of them is definitely your career. For individuals who are in a career field where it's a passion of theirs, it's not just a job, it's something they're incredibly in love with, very passionate, very driven as a result of it. That's why they become oftentimes A-shers, right? Because they feel so much about what they do. For them, if they're also struggling with gender dysphoria, it's an interesting phenomenon because it kind of becomes a coping mechanism because their sense of whole self is so, it's almost as if this pizza slice of careers that they love so much overshadows anything else that may be going on anywhere else. And so as a result, it's a little bit easier for them to cope with dysphoria because their mind is so preoccupied with what they're doing and they get so much pleasure and so much gratification and validation from that part of their identity, right? And only later in life they realize, oh, I have gender dysphoria. And in fact, a lot of these people would describe to me their dysphoria not being very severe. It's there. And I know this is not congruent with who I am, but it's not excruciating. It's not painful, but it's definitely there. And this is definitely not the genders that I see myself being. So that's a very interesting phenomenon. And I see this a lot. I always say the reason why is because you're so passionate about what you do. It's overshadows everything else. It's in a way kind of a blessing for a lot of people who grew up during time where they couldn't do anything about their gender issues because it allowed them to live with dysphoria without a very strong and painful agony.
I have to explore that because that is so interesting to me. This idea
Yeah.
that the only thing that not the only thing, but a thing that helps them cope with the alleged pain of gender dysphoria is becoming high achieving. So it's not that you're high achieving and might be gender dysphoric. It's a compensatory mechanism to address the possible pain that goes through. Is that fair?
Yes, but it's not so much that it makes them be high achievers. It's the fact that these are individuals are in the right place of their vocation. They love what they do. They're very passionate, and they get a lot of validation and gratification because they found themselves in this part of their life. Right? That's where it comes from. It overshadows then any dysphoria they may feel. It's still going to be there,
Yeah.
but when you're getting right for a lot of other adult individuals, I see the reverse where they're in a part, they're struggling with gender dysphoria. Unfortunately, they go into work fields where, they just went into it because maybe they're good at it or just, it financially was supportive. They're not really happy about what they do for a living. They try to mitigate dysphoria by telling themselves this is not real. Maybe if I go into very classic overcompensatory stuff, maybe if I go into military, very classic one, right? And then it's truly true, I'm not trans, or maybe if I do this and this, or maybe if I become a parent. And they do this subconsciously. It's almost as if they're sleepwalking through their life. It's the denial is so deep. They're not fully cognizant and fully aware what dysphoria is telling them. They feel something is off, but they can't put their finger on the pulse. So that's a very different category of individuals, and they struggle tremendously because the pain is there. They don't often know what it is. They're trying to figure out what it is, and then one day they figure it out, and that's what I call having gender crisis, when they're like, oh shit, this is what it means. This is scary, this is overwhelming, but at the same time relieving because now you really know what you've been struggling with.
So I have to ask, is it better to know what you're struggling with and accept what you're struggling with and deal with what you're struggling with, or ignore what you're struggling with and become a high achiever because you don't have to pay the price of society having to deal with your
that's
expression?
$1 million question. So I would say, and I want to also to point out, it's not about, again, becoming necessarily high achiever, but you have to find what you love, you're doing. It's hard to say because I would say that for people who grew up, especially in a time where it was impossible to do anything about their gender because the world was not as gender, there was not so much gender affirming care as there is today. Back then, for a lot of them, it potentially was a saving grace that they were either in denial. And I always tell people the reason why you're aware of it now is because your psyche is also organized in a way where it's trying to subconsciously protect you. our subconscious knows also what's going on. And if you were fully aware, it probably would have been incredibly difficult for you back then. So it's hard to say. Everybody copes drastically different. I think that everybody has a right to cope in a ways that helps best for them, whether it is considered to be, being in denial for a long time or overcompensating by throwing yourself into the work that you love so much. Um, Gender dysphoria is one of the things that I'm like, hey, there's no way anybody should ever judge how you cope with it. You do the best you can. I will, as a psychologist, point out how the coping is detrimental to your health and how going down the path of particular coping is going to destroy your health and destroy your well-being. But I'll leave you with that so that you can decide what you want to do about it. Because it's not easy. This how society spins this idea that trans people just jumping into surgeries, right? Trans adults, especially. Trans adults, if anything, are very hesitant because they know how life-altering gender transition is for those who decide to go down the path. So they're very mindful. They're very lucid. They consider all the pros and cons. So it's, you cope, you do the best you can. You definitely do the best you can.
We have to have you back to discuss so much more of this. This is, we haven't even touched the surface of this, and I'm like totally blown away by the conversation. But I'm going to ask you one last question, which I think is sort of, I have literally about 6 questions lined up, but I'm going to stick with one. But you talked about this pizza pie analogy, and you said it's a pizza pie. You cut it up. Usually, your identity is one slice, and your job is another slice, and your kids are another slice, and your gym is another slice. Why is it at some point in your life that slice you've been ignoring the whole time is unignorable?
Because we can't help but, let me rephrase that. What you resist persists. Our psyche has, and I'm a strong believer into this, and this is my view, it may not be in alignment with everybody else. I strongly believe that we are born into this life with particular strengths and particular soul signatures, I would say. One of the soul signature is your gender identity. And it's one of the things that is so true and so authentic to the core who you are, that no matter what you do to try to ignore it, it will always find its way to the surface. It's like putting a lid on a pot. Eventually, the lid always comes off. I have yet to see a person where the lid has not come off. Now, what you do after the lid comes off is up to you, but it does come off. And the reason why it comes off is a good thing, because that's who you are. That's absolutely who you are. For me, for example, my strength is being able to speak and communicate complex issues in a simple manner. No matter how much I will try to avoid not to be on platforms and speaking and sharing the content, I'll probably be very miserable because that's my soul signature. Gender is one of the things that is a soul signature for so many people. And it's denying yourself that. It's almost as if you're denying yourself something that is so innate and intrinsic to who you are. And that's impossible.
That is so amazing. I so want to do a whole discussion on soul signatures with you, but we have to call it where the time just went by really, really quickly. Dr. Z, this was incredible. But before we go, a couple of things. You have a book. Do you want to tell us about the book?
Yes. So briefly. So I wrote a book that just came out. Well, it has my great after copy. Everybody else won't have it. So the reason why this book is so great is called On New Terms, Gender Transition Redefined for Adults. This is a very unusual book. This is not Transgender 101 guide. This is not how you're going to go through transition, because I don't believe anybody should be telling you how to go through transition. It should be on your terms and for you to decide which elements to go through. The book is fascinating because it is quick, punchy, direct, to the point, and it's aimed at breaking down limited beliefs that so many tell themselves that keeps them stuck. A lot of societal ingrained things that keep them stuck, as well as it aimed at empowering people to step into their power. And especially today, as you know, what's going on in the world, it's so quickly to disempower gender diverse individuals because society is so quick to just point fingers. This book is aimed to do the opposite, to give the power to you, to make you feel rooted and standing very strong in who you are in your authenticity. So that's the book. And it's right now, I don't know when you're going to air it. I think we discussed this, but it's 99 cents on Kindle until Tuesday. And if anybody watching this absolutely cannot afford the book, they have to just email me. I'll send them a free PDF.
Well, that's very kind. For those people who want to buy it not off of Kindle, where can they find it?
Amazon.
On Amazon. And what is it, the book called again?
On New Terms, Gender Transition Redefined for Adults.
Awesome. Dr. Z, you're amazing. Thank you so much for coming on here. I can't wait to have you on again.
Thank you so much.